Hello, everyone. My name is Corey Thornton. I'm the senior editor here at Open Minds, and welcome to today's Circle Executive Roundtable, Transforming the SUD Treatment System, the Shatterproof Treatment Atlas case study, featuring Dr. Lisa Kugler, Senior Vice President for Shatterproof Treatment Atlas. Before we get started, I have a couple of housekeeping reminders. Your audio is muted for today's briefing. However, we encourage you to submit any questions using the question box located on the right side of your screen. If time permits, at the top of the hour, we will answer some of those questions. And finally, the slides and the recording for today's roundtable will be archived and available for elite members on the Open Minds website starting tomorrow. And with that, here's Dr. Kugler.
Good afternoon, everyone, and thank you so much for joining today. What I'd like to talk about today is a little bit that has probably touched almost all of our lives, and that is the subject of substance use disorder. I'd also like to talk with you a little bit about Shatterproof and Shatterproof's solution around treatment and making treatment transparent in the SUD space treatment atlas. Some of the goals for today's session include learning about 3 gaps within the current system for finding SUD care, being able to list 5 indicators of high quality care within the SUD system, and describing how Treatment Atlas sought to address the gaps to better support individuals and their families finding SUD care. Some of this will likely not be surprising. However, really looking at the impact that substance use disorder has had on our communities and our families at times can really be surprising. Very recently in 2024, Kaiser Family Foundation did a recent study on the number of individuals that have been impacted by substance use disorder. And the threshold was relatively high. They had to have either been addicted to drugs or alcohol, experienced homelessness, or experienced an emergency department or overdose. And what was found by Kaiser Family Foundation was that 2 out of 3 adults said that either themselves or a family member had been addicted to alcohol or drugs and had experienced one of those outcomes. Approximately 46.3 million people, or 16.5% of the population, has met the DSM-5 criteria for having substance use disorder in the past year. This includes 29.5 million individuals with an alcohol use disorder and 24 million with a drug use disorder. And among those who say that they or a family member experienced substance use or addiction, less than half report that they or their family members got treatment for the substance use disorder, and of those, only about 12% received the specialty care either at a residential, outpatient, or an agency that specializes in substance use disorder. In addition to the scourge of the substance use disorder, health inequities also permeate the substance use disorder field. Individuals who identify as Black enter treatment for substance use disorder 4 to 5 years later than white individuals. White patients are 4 times more likely than Black patients to receive prescriptions for buprenorphine. Buprenorphine is seen as the gold standard for opioid use disorder and one of the primary medications to treat opioid use disorder. In 2020, the overdose rate per 100,000 was at 54.1 for Black men and 44.2 for white men. You can see through all of these statistics that although the epidemic is truly impacting everyone, those who are in marginalized groups are impacted even more. This is then compounded by some lacks around evidence-based practices, the promotion of evidence-based practices for marginalized groups, and building awareness and trust within the system so those that are in the marginalized groups feel comfortable accessing the care that will best support them and their family members in their process of recovery. Part of this has been identified as the intersection between systemic discrimination, self-stigma, stigmatizing behaviors of the community, and even some of the stigma that may be experienced within the treatment facilities. One of the things that I think is oftentimes missed is whenever we're talking about the impacts of substance use, a lot of focus is on opioids, opioid settlement dollars, overdoses, etc. However, one of the things that I think that we're missing is the rise of alcohol. This has really been occurring since the onset of COVID, and it's just continuing to skyrocket. There's even been a change from 2021 to 2023. The statistics that are on the right-hand side of the screen with the death at 140 actually increased just last year to 178,000 deaths. And it's continuing to go up. I think that part of the reason that alcohol is oftentimes not discussed as much as opioids and opioid use disorder is because death from alcohol use tends to be a slower process. It also tends to be coded differently. It's generally cirrhosis. It can be a contributing factor in heart disease. It can also be a contributing factor to hypertension, pancreatitis, etc. So there are many ways that alcohol use disorder can negatively impact and ultimately lead to death. As you can see throughout the different age groups, where it really spiked, especially for men, was in that 35 to 49-year-old, and also in that 50 to 64-year-old range. So especially in these two groups here, the alcohol use disorder and alcohol use disorder diseases have gone up exponentially. Alcohol also plays a secondary role in many other leading causes of death. One of those is accidents, and alcohol played a role in at least 7.1 of the emergency department visits. In addition, alcohol is oftentimes in an individual's system whenever they have a suicide attempt or even with overdoses to other substances. One thing I think was a bit scary, honestly, is those that are in college, that 18 to 25 range, it was approximately 15% of individuals met the criteria for a alcohol use disorder. So who is Shatterproof and why are we here? We were founded by Gary Mendel, who unfortunately lost his son to opioid use disorder. After the passing of his son, he really became committed and turned his pain to passion and purpose, and really wanted to help shape the landscape around substance use disorder. So he found through his own experience that there were several ways to do this, one of which was transforming treatment, which is what we're here to talk about today. He noticed that even with the multitude of resources that he had available, it was incredibly difficult to find out what was the appropriate level of care, what were the appropriate treatment supports, and what was really the best kind of treatment for his son. He also recognized that those with substance use disorder experience a significant amount of stigma. He will oftentimes tell the story of whenever his son was first diagnosed with substance use disorder, that many of the people of the community refused to interact with him or his family. His son had an increasing sense of isolation, and they noticed that less and less people came around to visit, and they did not receive any flowers if he went into treatment. They did not receive anybody coming around offering to cook dinner, etc. Whereas at the same time, there was an individual that was diagnosed with cancer, and they really got to see the entirety of the community pull together and pull behind that individual. And although these are two medical conditions, the reaction of the community was completely different. So from that moment on, he really saw it as one of the pillars of Shatterproof to end the stigma that is associated with substance use disorder. The other pillar of Shatterproof is educating and empowering communities and being able to provide to those communities science-based information around substance use disorder. There continue to be a lot of myths around substance use disorder, such as it's a moral failing or that people don't recover. And we're truly here in the faces of individuals in recovery or having loved ones in recovery to state that we know that recovery is possible. We know that this is a medical condition, and we're here to be champions for those who may be suffering in silence. There has always been a clear need for a resource that will guide individuals to the most appropriate evidence-based substance use disorder treatment while incentivizing the delivery of best clinical practices. This is not unique to the substance use disorder field. This has been going on for several years now with hospitals, with primary care physicians, etc. When the treatment is made transparent and evidence-based and strong clinical protocols are in place, there's evidence that there is overall better health outcomes and better overall recovery rates. So how did Shatterproof plan to implement around really changing that treatment landscape, and what was the background for the development of Treatment Atlas? It really all started with the Surgeon General's report of 2016. The Surgeon General's report came out with a number of high-level bullets that really outlined substance use disorder and what appropriate treatment would be for substance use disorder. It really indicated that addiction is a complex but treatable disease that affects brain function and behavior. It reiterated that there is no single treatment that is appropriate for everyone. Treatment needs to be readily available, and individuals need to understand what are the different options that are available so they can make informed choices about what care will best suit their needs. Effective treatment needs to attend to the multiple needs of the individual, not just his or her substance use concerns. That's really looking at the totality of the person, whole person care, to really identify what are all of the needs of someone, from behavioral health, physical health, social determinants of health needs, and how do we really all join together to best support the individual and that family. Remaining in treatment for an adequate period of time is critical. We've heard this over and over again, and there is sometimes myths in the field that this is only residential treatment. This really aligns with, as any chronic medical condition, remaining in care for an adequate period of time is critical. So that can be outpatient care, that can be engagement with an opioid treatment program, it can be IOP, it can be whatever works and is necessary for that individual to support their ongoing treatment. Also, really looking at treatment as a continuum versus discrete episodes, and being able to really support the individual if there are resurgences. Just as what would occur if someone was having diabetic, or if they had asthma, if there is resurgence, then addressing that resurgence and making modifications to the individualized treatment plan so that that individual can continue to move forward in their recovery. Behavioral therapies, including family, group, and individual, are the most commonly used forms of substance use disorder treatment, and medications are an important element of treatment for many individuals, especially when combined with counseling and other behavioral therapies. We recently looked at some of the data that we're gathering and compared it to some of the research that's available. Even though medications have been shown to be really that gold standard of treatment, we're still finding that about 60% of treatment facilities offer medication. Nora Vocal recently did an article, and she found that the number of individuals with opioid use disorder on a continuous medication for opioid use disorder was even lower at approximately 25%. So really engagement and making certain that individuals are aware of their options and talking through what are those evidence-based practices to best support an individual. Additional bullets from the Surgeon General's report include individuals' treatment and services must be assessed continually and modified to make certain that they address his or her changing needs. Medically assisted detox is only the first stage of addiction treatment, and by itself does not change long-term substance use disorder. The treatment does not need to be voluntary to be effective. This is one of those areas that is still a little bit nebulous, and there is research to support it. However, there are a lot of opponents to that as well, talking about if it is mandatory, that individuals who may be going against their will may be unlikely to engage in the future. The proponents of mandatory treatment find that there are many individuals that once they're regulated do make choices to align with recovery and ongoing recovery-based care. So it really does become more intrinsic over time. In addition, the Surgeon General really identified the treatment programs should really address, once again, that whole person care and look at the physical health concerns as well for things such as HIV, AIDS, hepatitis, tuberculosis, other infectious diseases, and provide risk reduction counseling and linking patients to additional treatment if necessary. One of the newest adulterants to opioids is really highlights this at this point in time, which is the xylazine. Xylazine is very prominent in Pennsylvania, Maryland areas, and it basically causes necrosis from the inside to the outside. So there are a multitude of sores that are occurring, and oftentimes these abscesses are not occurring right at the place where an IV drug user may be using, but instead are actually occurring inside and then working their way out. So more and more treatment providers are finding either coordination of care with wound care, or actually having wound care on site is necessary to treat those individuals that have used opiates with xylazine. Shatterproof recognized that to really transform research from the medical journals to a reality in substance use treatment, there are several key stakeholders, one of which is consumers, the other is providers, and the third is state, federal agencies, and payer entities. Treatment Atlas was designed to really impact and be available for all three of those groups. It is a web-based platform available to consumers regardless of coverage. We are currently available in 14 states. Our business model is that we are funded by either states or by payers or through philanthropy. And at that point in time, we take all of the providers that are located within the state and present their information on Treatment Atlas after gaining some additional data points, which I'll be going to in a moment. Treatment Atlas also contains a consumer-friendly needs assessment, which was endorsed and developed in conjunction with American Society of Addiction Medicine. All treatment facilities are identified by the state, so we work very closely with our states and partners to identify what would be most beneficial on the platform. In addition, the principles of care, which are the quality indices that were developed from the Surgeon General's report, were incorporated into the Treatment Atlas platform. There are also dynamic filters that help guide consumers to evidence-based care as indicated by the diagnosis and the level of care necessary. So the Shatterproof solution provides several key components. For the public, a free to the public facing platform that includes transparent information to support individuals in accessing high quality care at the appropriate intensity. For providers, a password protected portal and continuous quality improvement series to support providers in implementing evidence-based practices. For state, federal agencies and payers, a password protected portal containing provider level data to support the agency in determining network adequacy, areas of needs of technical assistance, and adoption of evidence-based practices. We have also begun talking with some of the states, federal agencies, and payers of utilizing some of the material on Treatment Atlas as a basis for value-based contracting or as an adjunct to some of the value-based contracting, and one of the things that could be included when making those value-based contracts. So exactly what was taken from the Surgeon General's 2016 report and then made into the principles of care. The first one, the routine screening in every medical setting, that should be occurring external to Treatment Atlas. So that one is the only one that is not actually shown on the Treatment Atlas platform. The other ones are for every facility that provides us with their information. They include a personalized plan, fast access to treatment, long-term disease management, coordinated care, behavioral health care from legitimate providers, medications for addiction treatment, and recovery supports beyond basic medical care. And this was not just Shatterproof coming up with it on our own. It was really developed by an expert committee and the National Quality Forum, and 23 health plans covering over 170 million lives have agreed to promote and reward care that is aligned with these principles. So what exactly is the platform and how does it differ from other locators that are out there? So Treatment Atlas includes both a treatment facility survey, which the treatment facilities complete. It is an online survey administered at the facility level that assesses processes, structures, and services. And this is then validated. Over 70% of the states have greater than 60% of their treatment facilities that have voluntarily submitted the treatment facility survey, and the highest submission percentage for a state is at 83%. With the treatment facility surveys, it is completed by the facility. It does need an attestation by a C-suite individual. It then goes through multiple validation processes through Treatment Atlas. We check it with external available data as well, including credentialing and licensing data. And then if there's any areas that appear to be mismatched, we will reach out to the treatment facility survey and ask for a correction or clarification. We also have on the platform patient experience surveys or consumer perception of care surveys. These are based on CAP's ECHO questions about the use of best practices and perceptions of care, and one open-ended question that can be completed by the consumer or a loved one. After there is 10 of the consumer perceptions of care, they are displayed on the platform for individuals who may be seeking care to be able to see. So we continue to expand throughout the United States, really looking to grow to a 50-state solution. We started in 2020 with 6 states, which represented 13% of the United States population. In 2022, we grew to 10 states, which represented 28% of the United States population. And in 2023, we grew to 14 states, which represented 45% of the United States population. By the end of 2024, we expect to reach approximately 55% of the United States population and be available fully to that 55%. Here are some of the funders currently and previously with Treatment Atlas. As you can see, there's multiple state agencies, health insurers, and as I mentioned, philanthropy also partially funds Treatment Atlas. We recently are, well, actually we are currently working with Deloitte to work on engaging marginalized populations to really address some of those disparities that we talked about much earlier in the slide presentation. This is the consumer-friendly needs assessment that is embedded within the platform. It's 10 questions, and it assesses risks and severities of an individual with substance use disorder, and it makes recommendations on level of care, clinical services, and recovery support services. Treatment Atlas results are then filtered to show options that are aligned with the assessment recommendations and that are most aligned to the principles of care. This is the professional portal that is on the back end. This is what's available to state agencies and to payer agencies. In addition, each provider has access to their own professional portal, so they're able to see how they align in relation to the other treatment facilities within the state in an aggregate manner. They would not be able to see, for example, every single treatment facility and how they align specifically with that treatment facility, but they would be able to see within aggregate how they are doing in comparison to the other treatment facilities within their state. So this is the QR code. I am going to be going to Treatment Atlas just to show a little bit of how the platform engages with the consumer. So feel free either to scan the QR code, or you may also just follow along. Here is also the link if anyone would just like to click on the link and go to the platform with me. So this is Shatterproof Treatment Atlas. We are constantly under revision and we are constantly refining processes to really best align and provide the best consumer experience possible. So if we type in a location, I just happen to be from Pittsburgh, we can go directly to Pittsburgh, Pennsylvania. We recognize that every consumer's journey might be slightly different. So if someone would choose, they can actually see all centers near Pittsburgh, Pennsylvania, and it will take them directly to all of the centers, and it will list them from closest to furthest away. Or if someone would like some assistance in choosing, they can go to the Help Me Choose. In addition, you will notice that some of our state partners or funders have asked for some customization. So this is something else that we do engage in quite often. For Pennsylvania, they have asked for some information at the top. specifically for individuals who may be funded through county funding. So if we go to the ASAM assessment, we can go through and identify which substances may be causing a person problems, how hard is it for an individual to stop using, what withdrawal symptoms does an individual have, and an individual can fill this out or their family member. We oftentimes do find that more family members are the ones completing the 10-question assessment versus the individual, but we did want to make sure that it is consistent and easy and does not have a significant cognitive load in case it is the individual who may be in more of a crisis situation completing each of these questions. Asks about any kind of mental health concerns, any suicidality. If anyone wants to stop at any point, they can see their results at that point in time. What are some of the needs of an individual? What are the social determinants of health? In addition to peer support services and church or spiritual services, is there any kind of legal requirement? And then what is the motivation to change? So based upon the responses, an individual then receives basically a recommendation. So it does talk about sort of the gold standard for opioid use disorder is medications, and it also gives those additional concerns that were indicated what an individual may want to look for. That, for example, with the way that I had answered the questions, it also suggests looking for a program that would help with shelter and transportation. So if we then begin look at recommended, you can see that what the program offers, all of the things are checked. We can also look at what sort of insurance an individual may have and whether it is something that is covered or offered by that provider. It will then pop to the top if that is an insurance that that provider accepts. All of these are hot links right here. And so an individual can contact any one of the facilities directly from the platform. So an individual can either call, email, go to their website, or fill out a form that will direct them directly to that website or directly to that provider. If we go to the provider's facility page, you'll be able to see what all are the services that are offered by this facility. So you can see which substances they treat, the treatment services that are offered, medication, mental and physical health, ways to pay, etc. You can always show more, and there is more detail down towards the bottom of the screen, exactly which behavioral therapies are utilized, which medications, what kind of counseling, etc. We at Shatterproof, as I mentioned, this is a public platform that is funded by our partners. So we do training in the communities to help raise awareness. That's part of what we're doing pretty significantly with our Deloitte work, is we are doing outreach in a number of marginalized communities with individuals that may be unfamiliar with Treatment Atlas. Basically, we utilize overdose information along with our traffic reports and see where there's a mismatch. Then we begin to build relationships within those communities, whether it's through soup kitchens, looking at that county, looking at referral sources, hospitals, 211 lines, etc. This is the principles of care, and we currently do it in a donut. So anyone can see very quickly at a glance how aligned is this facility with the principles of care, which once again are based on that 2016 Surgeon General's report. And this particular facility is meeting all except for one. It's meeting some of the criteria, but all of the rest of them, it's meeting all of the criteria. For example, an individual has fast access to services. And if anyone wants to see the details of what does that mean, same-day walk-in appointments are available. There is a personalized treatment plan. Medications for opioid use and alcohol use disorder are offered. Behavioral therapies are offered. There's coordination between mental and physical health care. There's long-term care management. And there are also support services. In addition, down here, someone can see if a facility offers telehealth. There's also filters that allow for individuals to see whether there's youth services there, whether there is LGBTQIA+ services or any specific programming for various groups. In addition, you can see whether it offers specialized groups for veterans, pregnancy, etc. I also wanted to show if there is at least 10 or more consumer perceptions of care, how that appears on the website as well. As I mentioned, this is based on AHRQ, CAPS ECHO, so they are reliable and valid within the field. And this is how they present on the website. So you can see that if someone leaves a review, which is very easy for anyone to do, so either it's an individual or their loved one, and every single consumer perception of care review that comes through goes through both a automated language processing and a human review. We are also really encouraging individuals to submit their review of the treatment they received. This is the best way for individuals to really find out whether it will work for them or not, and what others have experienced there. Some of the most recent research shows that about 80% of consumers, all of us, utilize online reviews to help us make a determination in anything from buying a purse to going to a hospital. And we want individuals that are seeking substance use disorder care to be able to have that same kind of experience. So we do have a weekly sweepstakes for $50 gift card for anyone who does complete the survey. It is completely anonymous. So we do separate the survey responses from if someone then chooses to enter themselves into the sweepstakes drawing. And this is the questions that are on there. So if we go back, it really gives, first of all, an overall rating, and then also by features. So if the treatment was helpful, if it was timely, if the staff was respectful, if the individual felt as if they received tools for coping, family involvement, and information about other options. One thing that we have also recently been done within the treatment atlas is we now allow for facilities to provide images of what their facility looks like. So individuals can look at the different pictures and see whether this is something that may fit for them or not. So it really is a comprehensive solution, really evolving from whenever we were, many of us who may have started in the substance use field when we were first working off of PDFs and off of Excel spreadsheets as to where to send someone. This really is a comprehensive platform that allows all treatment facilities to really be gauged the same way, and really takes out some of the guesswork. I really strongly recommend anyone working with case management services, etc., to not encourage their clientele to just do a Google search or anything like that. Just as a kind of experiment, I did a Google search from southwestern Pennsylvania, and whenever I did a Google search for residential treatment providers, I began getting all of these ones that had significant marketing, and I was being shown luxury resorts in Malibu. Oftentimes these are self-pay. And the quality of the care may or may not be substantially high. So really working with the consumers that may be struggling with substance use and their families on finding that care that best meets their needs and will really best support their recovery journeys. We are continuing to evolve, and as executives that are very interested in this topic, it may be even a question of, if Treatment Atlas comes to you and says, we are entering into your state, please complete the treatment facility survey, what are some of the benefits to you? Since the beginning of the year, we have had over 500,000 individuals visit the Treatment Atlas website. Of those, we are finding that over 60% are engaging with those providers that are in the top 80% of alignment with the principles of care. That's huge. That's really driving and encouraging individuals to seek care that will best support their needs, and at those treatment facilities that are offering evidence-based practices. We are seeing more and more traction, and that traction grow. We're continuing to look at ways to refine the offering, and we're continuing to look at ways to engage our consumers. You will see over here, this is actually one of the things that we review very, very frequently. This is called Clarity. If anyone's familiar with it, we're finding about 80% of our traffic is through mobile means. So we start looking at what are things that are being clicked on, or where are there rage clicks that are not live links, and how do we make the site cleaner so that those individuals that are coming, that we can truly support them through the recovery episode. I am a licensed clinician. I'm a psychologist previously, and this excites me so much. I am so passionate about the individuals that have been struggling with substance use and helping them and guiding them to that care that can provide them with hope that matches their needs and that really will best support whatever their recovery efforts may be. And I've heard from a number of individuals that different people come in with different focuses and different needs. For example, one individual that I was talking to, his son is a special needs individual, so he had to have access to his cell phone, and he did not want to go to a treatment facility that would not allow him that. So that was one of the things that he filtered for, was really being able to find a facility near him that would allow him to have his cell phone as well. So one of the things we're working on is improving that consumer journey, looking at ways to improve the homepage, looking at ways to even reduce the language more to be able to make it more consumer friendly. We're also looking at ways to customize based upon the needs of the funder. As I mentioned with Pennsylvania, they really wanted to be able to guide individuals that were county funded to that appropriate county so that they may access the services they need. We're now able to customize based upon that. We really worked and invested heavily in our infrastructure so that we have a data warehouse that allows for the ability to update the listing of providers at any point in time in near real time. So one of the challenges that we've heard ongoing is that some of the platforms that are out there do not have up-to-date information. Ours, the providers can update it at any point in time. We also have restructured so that we have individuals on the team that are specifically dedicated to working with the providers. So we're building those relationships. Sometimes whenever a provider opens a specialty program, we are able to put that on our website, and we sometimes know about it even before the state does. So we're able to provide that feedback loop as well. We're also, with the investment in the infrastructure, able to do advanced analytics to allow for refinements and approaches and outreach based upon the needs of funders. If we're looking at where are we not seeing as high of utilization as we would expect, how do we engage that population? And we're doing increased outreach to marginalized groups, testing and refining some of our marketing materials, testing and refining our messages to really best engage those groups and those individuals. Some of the future directions and how we also continue to plan to support individuals, providers, and our funders is we're looking into feasibility of including claims-based measures into Treatment Atlas and how that really translates into into differentiation at the provider level. We're looking at expanding services available on the platform through partners or building out a Treatment Atlas. Through Q4 and then through the beginning of next year, we will be expanding to include telehealth-only providers. Currently, the list we're receiving from the state and the platform itself includes any bricks and mortar providers. It will also include those providers that offer telehealth, but it is not telehealth only. So we're really looking to expand our offering to that in the fall. And we're looking to be able to customize more. Currently, it's primarily banners, but we're looking to be able to provide unique URLs to, say, payers so that they can have it for the totality of their network. They'll be able to indicate what are some of their centers of excellence and really being able to work with the payers and the states on making it work for their constituents versus versus what you're seeing today. We're also looking and exploring the ability of doing composite rating. This would be a longer term roadmap and really a process where we would utilize the expertise from the field and really look at what are the different ways to differentiate and to make that very digestible by the public so that they can easily see what is the best treatment provider for themselves or a loved one to best support them in their recovery efforts. Thank you very much for all of your time today. If there are any further questions, please do not hesitate to reach out. In addition, with the deck, there is additional information if anyone is interested. Sometimes I get questions about, how are the treatment facility surveys validated since they are completed by the treatment facility. This gives a bit more information on what that validation process looks like. This is also, some of the claims-based measure, the evolution that has gone through as well, and really why we're reinstituting it now and how are we incorporating some of the lessons learned from previously. We're oftentimes asked about our claims-based measure pilot as we're looking at, what does that feasibility look like? What are some of the priority measures that we're looking at? We did define these priority measures based upon our partnership with Mathematica. We also have a claims-based work group that has provided us feedback, and that work group is comprised of various state partners, payers, and providers. So the claims-based measures that we're going to be focusing on include initiation and engagement of alcohol and other drug use treatment, continuity of medically managed withdrawal, follow-up for those newly prescribed an SUD medication, and all-cause ED utilization rates. So that is still in the feasibility phase. So we're hoping to be able to report back out on that in the fourth quarter of this year. Okay.
Dr. Kugler, thank you very much. It doesn't look like we have any questions today, but I would like to let everybody know if they do have any questions after the webinar, they can either reach out to Dr. Kugler with the information she provided, or they can reach out to Open Minds and we will put you in touch. I want to thank everybody who joined us. I also want to remind you that the slides and the recording for this will be made available on the Open Minds website starting tomorrow. Sometime in the next 30 days, we will do a management article on our website covering Dr. Kugler's work. You can also join us next week, Thursday, July 25th at 1 p.m. Eastern for our next roundtable, Revenue Cycle Management Trends and Best Practices for 2024. To register for that event or for a full list of upcoming roundtables, you can visit the Executive Roundtables page located under the Events tab at www.openminds.com. Dr. Kugler, thank you again. This has been very informative. We'll be in touch to continue showcasing your work in the coming weeks.
Thank you so much. And thank you everyone for attending today. Really appreciate your participation.
Absolutely. Thank you, everybody, and take care. Have a great weekend.